these remarkable tools that serve you constantly, yet often receive little care or appreciation. Your hands work tirelessly throughout every day. They wash dishes, type on keyboards, open doors, prepare food, care for others, create and connect. They're constantly exposed to water, chemicals, sun, cold, and countless environmental stressors. Yet most people spend far more time caring for their faces than their hands. Your hands deserve better. They deserve care, protection, and gratitude. Let's understand why hands age so visibly and what you can do about it. The skin on your hands is relatively thin with few oil glands. This makes hands prone to dryness. Your hands are exposed to the elements constantly: sun, wind, cold, unlike your face, which you might protect more carefully. Hands are washed frequently, often with harsh soaps and hot water, stripping away natural oils. Hands come into contact with cleaning products, dish soap, and other chemicals that damage skin. All of this leads to dry, rough, aging hands. Sun damage on hands is particularly visible. Age spots, thin skin, prominent veins, and wrinkles all result significantly from cumulative sun exposure. Your hands spend more time in direct sunlight than almost any other body part. Yet how often do you apply sunscreen to them? Hand washing, while necessary for hygiene, takes a toll. Every wash strips some natural oil from your skin. In a world increasingly focused on hand washing for health, which is important, your hands need extra care to compensate for this increased washing. Now let's discuss comprehensive hand care. Starting with protection. Sun protection for hands is crucial yet often neglected. Apply sunscreen to your hands every morning. Apply the same sunscreen you use on your face, or use a hand cream with SPF. Reapply after washing hands if you'll be outdoors or near windows where your hands receive sun exposure. When driving, your left hand if you're in the US or right hand if you're in the UK gets significant sun exposure through the car window. This asymmetric exposure often results in one hand showing more sun damage than the other. Apply sunscreen before driving, or consider driving gloves for protection. Wearing gloves when doing dishes, cleaning, or gardening protects hands from harsh chemicals, hot water, and physical damage. Yes, it's an extra step, but your hands will be notably healthier with this protection. In cold weather, wear warm gloves or mittens outdoors. Cold air is dry air, and exposed hands in winter become chapped and damaged quickly. Now let's talk about moisturizing hands, the foundation of hand care. Apply hand cream after every hand washing. This is the single most important habit for hand health. Keep hand cream beside every sink you use regularly. Keep a tube in your bag. Keep one on your desk. Make reapplication automatic and convenient. Choose a good quality hand cream that actually moisturizes rather than just feeling nice for a moment. Look for ingredients like glycerin, shea butter, ceramides, or hyaluronic acid. These provide real, lasting moisture. For daytime, choose a hand cream that absorbs relatively quickly so you can return to your activities without greasy hands. For nighttime, you can use richer, more intensive creams. Apply hand cream generously. Don't just dab a tiny bit. Use enough to cover your entire hand. Massage it in thoroughly, including between fingers, around nails, and up to your wrists. For extremely dry hands, consider overnight treatments. Apply a very thick, rich hand cream or pure shea butter before bed, then wear cotton gloves while sleeping. This intensive treatment allows deep moisture penetration and repair. Do this weekly or nightly if your hands are severely dry. Let's discuss hand washing because the way you wash matters. Use lukewarm water rather than hot. Hot water feels good but strips skin more aggressively. Choose gentle moisturizing hand soaps rather than harsh antibacterial soaps. Most hand washing doesn't require antibacterial soap. Regular soap with proper technique is effective for cleaning hands. Wash for the recommended 20 seconds, but not longer than necessary. Over-washing strips beneficial oils. Dry hands thoroughly, but gently. Pat rather than rubbing hard. Damp hands are more vulnerable to chapping and irritation. Immediately apply hand cream after drying. This seals in remaining moisture and provides a protective layer. If you must wash hands frequently for work or health reasons, be extra diligent about moisturizing. Compensate for increased washing with increased hand care. Now let's talk about exfoliation for hands, because rough, dry hands benefit from gentle exfoliation. Once or twice weekly, gently exfoliate your hands. You can use a body scrub, a homemade sugar and oil scrub, or simply a soft, damp washcloth to gently rub away dead skin cells. Focus on areas that tend to be rougher: knuckles, the backs of hands, around nails. After exfoliating, rinse thoroughly and apply hand cream immediately. Exfoliated skin absorbs moisture better. For very rough areas like knuckles or cuticles, you might use a gentle AHA lotion designed for body skin. Lactic acid or glycolic acid lotions applied regularly gradually smooth rough texture. Let's address specific hand concerns. Age spots, those brown spots from sun damage, are permanent once formed, but can be faded somewhat with consistent use of brightening ingredients. Vitamin C, niacinamide, or gentle retinol applied to hands can help fade dark spots over time. Prevention through daily sunscreen is most effective. Professional treatments like laser or chemical peels can also help but require dermatologist consultation. Dry, cracked skin on hands needs intensive moisture. Use thick creams with urea or lactic acid to help repair severely dry skin. Overnight glove treatments help significantly. If skin cracks and bleeds, protect the cracks while they heal and moisturize diligently. Prominent veins and thin skin are natural aging changes, but are accelerated by sun damage. Prevention through sun protection is key. No cream can plump skin significantly enough to hide veins, though well-moisturized skin looks somewhat better. Eczema on hands is common and uncomfortable. Use fragrance-free, gentle products. Avoid known triggers. Moisturize constantly. Protect hands with gloves during tasks that worsen eczema. See a dermatologist if over-the-counter treatments aren't sufficient. Let's discuss nail and cuticle care, because these are part of hand care. Moisturize your cuticles as part of your hand care routine. Dry, ragged cuticles look unkempt and can become painful. Gently push back cuticles when they're soft, after showering or hand washing, rather than cutting them. Cutting can lead to infection and damage. For dedicated cuticle care, apply cuticle oil or a rich balm to your cuticles and massage it in. Do this nightly for best results. Keep nails trimmed and filed to a comfortable length and shape. Clean under nails regularly but gently. Avoid harsh tools that can damage the nail bed. If you get manicures, ensure the salon follows proper hygiene practices. Bring your own tools if possible. Don't allow cutting of cuticles or aggressive pushing back that causes pain or bleeding. Now let's talk about hands and hygiene in medical or food service contexts, where hands must be washed extremely frequently. If your work requires constant hand washing, you face special challenges. Your hands need extraordinary care to compensate. Use the gentlest soap available that still meets hygiene requirements. Apply hand cream every single chance you get, every break, every transition between tasks. Keep intensive hand treatments for overnight use. Consider consulting a dermatologist about prescription-strength hand creams if your hands become severely damaged. Some workplaces provide barrier creams designed to protect hands from frequent washing. Use these if available. This isn't vanity. Severely damaged hands can develop cracks that become infection risks, and painful hands make work harder. Caring for your hands in these situations is occupational health. Let's address when to see a professional about hand concerns. If you develop persistent rashes, itching, or reactions that don't improve with gentle care, see a dermatologist. You might have contact dermatitis from an allergen or irritant that needs identification and avoidance. If you have painful cracks that don't heal, infection risks increase. A dermatologist can provide stronger treatments. If you notice unusual growths, persistent spots that change or bleed, or anything that concerns you, have it examined. Hands, like all sun-exposed skin, can develop skin cancer. If eczema or other conditions significantly impact your quality of life, despite over-the-counter care, professional treatment can help. As we come toward closing, let's remember that hand care isn't complicated or time-consuming. The essentials are: moisturize after every hand wash, apply sunscreen to hands daily, wear gloves when appropriate for protection, use gentle hand washing practices, and give hands intensive overnight treatments weekly. These simple habits done consistently. Welcome to this peaceful, supportive space. Take a deep breath in, feeling your body relax completely. Exhale slowly, releasing any worry or tension. Today we're going to talk about something that affects so many people with such tenderness and care: how to reduce acne gently and safely without harsh treatments or aggressive approaches that can damage your skin. If you're dealing with acne, first know this: you are not alone, you are not doing anything wrong, and your skin is not broken or bad. Acne is an incredibly common skin condition that affects people of all ages. It's not a reflection of your hygiene, your worth, or your self-care efforts. It's a complex condition influenced by hormones, genetics, environment, and many factors beyond your control. The gentle approach to acne is about working with your skin, not against it. It's about supporting your skin's natural healing processes rather than attacking the acne with harsh, stripping treatments that often make things worse in the long run. Let's explore how to care for acne-prone skin with compassion and effectiveness. First, let's understand what acne actually is. Acne occurs when hair follicles become clogged with oil and dead skin cells. This creates an environment where bacteria can multiply, leading to inflammation and the formation of pimples, blackheads, or cysts. Various factors contribute. Hormonal fluctuations, stress, certain medications, diet, and genetics all play roles. Understanding this helps you approach acne treatment rationally rather than emotionally. Your skin isn't misbehaving. It's responding to internal and external factors. Your job is to support it in clearing those clogged pores and reducing inflammation, gently and consistently. The foundation of gentle acne care is proper cleansing without over-cleansing. This balance is crucial. You need to remove excess oil, dead skin cells, and bacteria. But you don't want to strip your skin so harshly that you damage your barrier and trigger more oil production. Use a gentle pH balance cleanser formulated for acne-prone skin. Look for cleansers with salicylic acid or benzoyl peroxide, but in low concentrations, 2% salicylic acid or 2.5% benzoyl peroxide are effective, yet gentle. These ingredients help unclog pores and reduce bacteria without being overly harsh. Cleanse once in the evening to remove the day's accumulation. In the morning, many acne-prone skins can simply rinse with water. Over-cleansing, even with gentle products, can backfire by irritating your skin and triggering more oil production. When you cleanse, use lukewarm water and gentle circular motions with your fingertips. Don't scrub, pick, or use harsh tools. Treat your skin with tenderness, even though you might feel frustrated with it. Aggression toward your acne only creates more inflammation. After cleansing, the next step is treatment. Gentle acne treatment uses proven ingredients at appropriate concentrations, applied consistently but not aggressively. Salicylic acid is a beta-hydroxy acid, BHA, that penetrates into pores, dissolving the oil in dead skin cells that cause clogs. It's oil-soluble, making it particularly effective for acne. Use products with 0.5 to 2% salicylic acid. You don't need higher concentrations. They're more likely to irritate without being more effective. Start by using salicylic acid every other evening. Apply it after cleansing on dry skin. Then wait a few minutes before applying moisturizer. As your skin builds tolerance, you can increase to nightly use if needed. But many people find every other night use sufficient and less irritating. Benzoyl peroxide is another effective acne treatment. It kills acne-causing bacteria and helps unclog pores. Use 5% concentration. Research shows it's just as effective as higher concentrations, but much less irritating. Apply it as a spot treatment or thin layer over acne-prone areas after cleansing. Be aware that benzoyl peroxide can bleach fabrics, so use white towels and pillowcases, or let it fully absorb before your face touches fabric. Some people use both salicylic acid and benzoyl peroxide, but not at the same time. You might use salicylic acid in the morning and benzoyl peroxide at night, or alternate them on different nights. Listen to your skin. If it becomes irritated, scale back to using just one. Niacinamide is a gentler option that supports acne treatment beautifully. It reduces inflammation, regulates oil production, and strengthens your skin barrier. A serum or moisturizer with 5% niacinamide can be used daily and works synergistically with other acne treatments. Retinoids, including over-the-counter adapalene or prescription tretinoin, are highly effective for acne. They increase cell turnover, preventing dead skin cells from clogging pores. However, they can be irritating, especially initially. If you use a retinoid, start with the lowest concentration, apply it only 2 to 3 times per week at first, and always use it with adequate moisturization. Retinoids are a long-term strategy. They take several months to show full effects. Now let's discuss moisturizing for acne-prone skin. This is crucial and often overlooked. Many people with acne skip moisturizer, fearing it will make them more oily or cause more breakouts. This is a mistake. Your skin needs hydration, even oily acne-prone skin. When your skin is dehydrated, it produces more oil to compensate, potentially worsening acne. When your skin barrier is compromised by harsh treatments, it becomes more vulnerable to irritation and infection. Moisturizer addresses both issues. Choose a lightweight, oil-free, non-comedogenic moisturizer. Gel or gel cream formulas often work well. Look for ingredients like hyaluronic acid for hydration, niacinamide for oil regulation and calming, and ceramides for barrier support. Apply moisturizer after your treatment products have absorbed. Don't skip this step, even if your skin feels oily. Proper hydration actually helps regulate oil production over time. Sun protection is absolutely essential when treating acne. Many acne treatments, particularly retinoids and acids, make your skin more sensitive to sun. UV exposure can also darken post-acne marks, making them take longer to fade. Use a non-comedogenic, oil-free sunscreen daily. Mineral sunscreens with zinc oxide work well for many acne-prone skins, as zinc has mild anti-inflammatory properties. Let's talk about what not to do when dealing with acne. Don't pick, squeeze, or pop pimples. This is perhaps the hardest advice to follow, but it's crucial. Picking spreads bacteria, causes inflammation, damages your skin, and leads to scarring. If you have a pimple that's ready to drain, do so with clean hands and gentle pressure only, then immediately apply a spot treatment. But mostly, hands off. Don't over-exfoliate. It's tempting to scrub away acne, but physical exfoliation can spread bacteria and irritate inflamed skin. Chemical exfoliation with salicylic acid is gentler and more effective. Limit exfoliation to 2 to 3 times per week at most. Don't use multiple harsh treatments simultaneously. Layering several strong acne products causes irritation, damages your barrier, and often makes acne worse. Choose 1 or 2 treatments and use them consistently but gently. Don't expect instant results. Acne treatment requires patience. Most treatments take 6 to 12 weeks to show significant improvement. This slow timeline is frustrating but normal. Consistency matters more than intensity. Let's discuss lifestyle factors that support gentle acne treatment. Clean pillowcases and towels prevent reinfecting your skin with bacteria. Change your pillowcase at least twice weekly, more often during active breakouts. Use a clean towel to dry your face, or dedicate a small towel just for your face that you wash frequently. Avoid touching your face throughout the day. Your hands carry oil, bacteria, and dirt that transfer to your skin. Every unnecessary touch can introduce new problems. Manage stress, as stress hormones trigger inflammation and can worsen acne. Whatever helps you decompress, exercise, meditation, creative pursuits, time with loved ones, is indirectly treating your acne. Stay hydrated and eat a balanced diet. While diet's role in acne is complex and individual, generally nutritious eating supports your skin health. Some people find that dairy or high glycemic foods worsen their acne. If you suspect this, try eliminating them for a month and observe. Get adequate sleep. Your skin repairs itself during sleep, and chronic sleep deprivation increases inflammation and stress hormones, potentially worsening acne. Now let's address emotional care while dealing with acne. Acne affects mental health and self-esteem significantly. Be gentle with yourself emotionally as well as...
Multiple studies demonstrate correlation between milk consumption and acne severity. The effect appears strongest with skim milk, likely because fat-soluble hormones are removed during processing, leaving bioactive peptides. If you consume significant dairy and struggle with acne, try reducing or eliminating dairy for 4 to 6 weeks to assess impact. Many people notice significant acne improvement after reducing dairy. If dairy doesn't appear to worsen your acne, you don't need to eliminate it. Omega-3 fatty acids reduce systemic and skin inflammation. Foods rich in omega-3s include fatty fish, salmon, mackerel, sardines, walnuts, ground flax seeds, and chia seeds. Eat omega-3 rich foods 2 to 3 times weekly or consider supplementation if dietary intake is insufficient. Studies show that increasing omega-3 intake improves acne, likely through inflammation reduction. Antioxidant-rich foods protect skin from free radical damage and reduce inflammation. Berries, blueberries, strawberries, raspberries, dark leafy greens, spinach, kale, colorful vegetables, carrots, bell peppers, tomatoes, and dark chocolate all contain powerful antioxidants. Eating colorful foods daily provides antioxidant support. Zinc supports immune function and skin healing. Foods rich in zinc include oysters, beef, pumpkin seeds, and chickpeas. Some evidence suggests zinc supplementation improves acne, particularly in zinc-deficient individuals. Typical supplementation is 25 to 30 milligrams daily. Don't exceed this without medical guidance, as excess zinc causes nausea and copper deficiency. Vitamin D plays roles in immune function and skin health. Sunlight exposure stimulates vitamin D production, but many people don't get adequate sun exposure. Vitamin D-rich foods include fatty fish, egg yolks, and fortified milk. Some people benefit from vitamin D supplementation, particularly during winter or in northern climates. Typical supplementation is 1,000 to 2,000 IU daily. Consult your doctor about appropriate dosing. Hydration deserves emphasis. Drinking adequate water, about 8 to 10 glasses daily, more with exercise, maintains skin hydration from within, supports detoxification, and promotes overall health. Proper hydration improves skin clarity and reduces compensatory sebum overproduction from dehydration. Limiting sugar and refined carbohydrates is perhaps the single most impactful dietary change for acne. Sugar causes inflammation throughout your body, worsens acne, and accelerates aging. Reducing sugar by replacing sugary beverages with water, limiting desserts, and avoiding processed foods with hidden sugar improves acne significantly. Most people notice improvement within 2 to 4 weeks of reducing sugar. Stress is a major acne trigger. Chronic stress increases cortisol production, which increases inflammation and androgen activity. Stress also triggers immune dysfunction, promoting bacterial overgrowth. Implementing stress reduction techniques is therefore essential. Meditation, yoga, deep breathing exercises, regular exercise, and time in nature all reduce stress and cortisol levels. Exercise provides multiple acne benefits. Regular aerobic exercise, 30 minutes, 5 days weekly, reduces stress, improves circulation, regulates hormones, and promotes overall health. However, exercise-related acne can occur from sweat and friction. Shower immediately after exercising, change into clean clothes, and avoid touching your face during exercise. Despite temporary exercise-induced acne risk, the overall benefits of regular exercise substantially outweigh risks. Sleep profoundly affects skin health. During sleep, your body releases growth hormone and reduces cortisol, supporting skin repair and reducing inflammation. Poor sleep increases cortisol, promotes inflammation, disrupts hormonal balance, and worsens acne. Consistently getting 7 to 9 hours of quality sleep significantly improves acne. Implement good sleep hygiene, maintain consistent sleep schedules, avoid screens an hour before bed, Keep your bedroom cool and dark, and limit caffeine in the afternoon. Alcohol consumption worsens acne through multiple mechanisms. Alcohol increases inflammation, disrupts gut health, which influences skin and dehydrates skin. If you drink alcohol, do so moderately and ensure adequate hydration. Heavy alcohol consumption noticeably worsens acne in most people. Smoking impairs skin healing, increases inflammation, and worsens acne. Smokers typically have worse acne than non-smokers. Quitting smoking improves acne and overall health dramatically. Gut health increasingly appears important for skin health. Poor gut microbiota diversity, gut inflammation, and increased intestinal permeability, leaky gut, correlate with acne. Eating fermented foods, yogurt, kimchi, sauerkraut, fiber-rich foods, vegetables, whole grains, legumes, and possibly taking probiotic supplements supports healthy gut microbiota. While gut acne connections are still being researched, the evidence suggests supporting gut health helps skin. Hormonal regulation through lifestyle is important, particularly for women with hormonal acne. Regular exercise, stress reduction, adequate sleep, and healthy diet all support hormonal balance. For women with PCOS or obvious hormonal acne, these lifestyle factors may reduce symptoms enough to minimize or eliminate the need for systemic medications like spironolactone or oral contraceptives. Important perspective: diet and lifestyle changes typically take 4 to 8 weeks to demonstrate skin effects. Don't expect immediate results. However, after 8 to 12 weeks of consistent dietary and lifestyle improvements, most people notice significant acne improvement. These changes provide benefits beyond acne: improved energy, better sleep, improved digestion, and overall better health. Guide 15: Professional dermatological treatments, chemical peels, laser therapy, and advanced technologies. Professional dermatological treatments provide powerful acne management beyond what home skincare achieves. Understanding various professional treatments, their mechanisms, appropriate candidates, and realistic expectations helps you make informed decisions about whether professional treatment is right for you. Chemical peels use acids to remove skin layers, treating acne, scarring, and texture issues. Superficial peels penetrate only the outermost skin layer and are the mildest type. These use low-concentration acids, 15 to 30% salicylic acid or glycolic acid, and require minimal recovery. Most people experience slight redness that resolves within hours. Superficial peels are appropriate for mild acne, texture concerns, and maintenance. Monthly superficial peels combined with home treatments provide excellent acne management. Medium-depth peels penetrate into the dermis, providing more dramatic results but requiring more recovery. These use higher acid concentrations